Hi, and welcome along to another Darns and Boyle video. Today we will be looking at identifying the main symptoms of high blood sugar levels in the body. You may also see this described as hyperglycemia or diabetes. We must say from the outset that if you believe that you are suffering from high blood sugar symptoms, we would always recommend that you seek independent medical advice. It is a serious condition. Approximately 88 million Americans are described as pre-diabetic. This is where they may be showing a few of the symptoms of high blood sugar, but have not been formally diagnosed with diabetes, and these are very much the people this video is directed towards. If you have already been diagnosed with type 2 diabetes, then you will already understand that this is a serious condition that if left unchecked can have very traumatic consequences. These will not be covered today but will be the subject of a separate video. However, the basic principles are the same for both. Let's firstly understand what high blood sugar is. Glucose is needed by the body's cells for respiration. It is important that the concentration of glucose in the blood is maintained at a constant level and controlled carefully. When the human body is functioning correctly, it uses the hormone insulin to remove glucose from the bloodstream. For people with type 2 diabetes, their body has become resistant to their own insulin, and however much insulin the pancreas creates, the body's cells do not respond properly to it, and so the glucose is not removed from the bloodstream as it should be. By continuing to eat the wrong foods, the problem simply gets worse. But there are a number of other causes of high blood sugar, such things as stress and illness, lack of exercise, being overweight, and for diabetics, incorrect self-administering of insulin. Other influences on whether you will be affected by it can be such things as your age, family history, ethnicity, and whether you have high blood pressure. If you are concerned that you may have high blood sugar, we recommend that you seek independent medical advice. So, what are the main symptoms of high blood sugar or diabetes? The first we will look at is that of increased thirst. With high blood sugar, your kidneys are forced to work overtime to filter and absorb the excess glucose. When your kidneys can't keep up, the excess glucose is excreted into your urine. This pulls fluids from your tissues, which makes you dehydrated and thus feeling thirsty. The second is the need to pee more often. Normally your body reabsorbs glucose as it passes through your kidneys, but with increased blood sugar, your kidneys may not be able to bring it all back in. This causes the body to make more urine. Because you're peeing so much, you can get thirsty. When you drink more, you'll also pee more. The next is that of increased fatigue. Fatigue is a common symptom of diabetes and can result from high blood sugar levels as well as other symptoms and complications of the condition. Some lifestyle changes can help a person manage diabetes fatigue. Fatigue and tiredness are not the same. When a person is tired, they usually feel better after resting. It may also leave you feeling hungry. You may also notice that your vision becomes blurred. High blood sugar causes the lens of the eye to swell, which changes your ability to see. Another common symptom of high blood glucose is a headache. Headaches can signal that your blood sugar is out of its target range. If you have frequent headaches, diabetes may be to blame and you should consult independent medical advice. The next symptom is that of unintentional weight loss. Insufficient insulin prevents the body from getting glucose from the blood into the body's cells to use as energy. When this occurs, the body starts burning fat and muscle for energy, causing a reduction in overall body weight. You may also have recurrent infections. High blood sugar from diabetes can affect the body's immune system, impairing the ability of white blood cells to come to the site of an infection, stay in the infected area, and kill microorganisms. The final one we will look at today is that of experiencing bad breath. High blood sugar levels increase glucose levels in saliva. This provides food for bacteria in the mouth and leads to the buildup of dental plaque. If plaque is not removed effectively, tooth decay and gum disease may occur, which also causes bad breath. This is not an exhaustive list by any means, and things like tingling limbs and high blood pressure are other common signs. And once again, If you recognize some of these, then we strongly recommend that you first seek independent medical advice, due to the potential seriousness of this condition. Once you have done that, you can start to look at ways to alter your lifestyle and diet. Such changes can have a positive impact on your health and well-being, and in most situations reduce the need and dependency on prescribed drugs. There are various diets and plans available on the market, but a good place to start your research is the Smart Blood Sugar program by Dr. Merritt. We suggest this program mainly because it addresses both diet and exercise regimes, and even has the option of natural supplements. It sort of covers all bases once the need for prescribed drugs has been ruled out. We have included the link for the official website for this program in the description below, which you can just click on. We have also done a review on this product, so if you want to review that first, then we will include the link for that also. I hope you have found that to be of interest, and we look forward to seeing you on the next video.